Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. How are you, doctor?
Very good, Luis. How are you doing?
I'm doing great as well. How was your trip to Canada?
It was lovely. It's always nice visiting home and looking forward to being back and having this video podcast with you.
Awesome. So here we are with a bunch of questions for you, but let's give you a topic today. This is questions Q&A about deployment methods for stem cell treatment. So in this case, doctor, the first question will be, how do you decide to implant the stem cells in your patients?
That's a very important question. A lot of patients do ask that. Basically, we will deduce what methods of deployment depending on the disease condition, the age of the patient, any limitations, specific locales if we need to inject organs or any sort of connective tissues or joints, retrobulbar injection. So depending, it basically comes down to age, the disease condition, and what type of effect we're trying to achieve.
Can you give us some examples of how you deploy these stem cells and considering the condition?
Yes. Okay, so that's let's consider, for example, a neurological condition. When we talk about a neurological disease or neurological degeneration, we're usually talking about the brain, the central nervous system, the spinal cord. In that regard, we want to deploy the stem cells. Almost always we deploy IV stem cells, intravenous, so that's everywhere the blood flows. When we do IV stem cells for a neurological condition, this could include Alzheimer's, dementia, Parkinson's disease, as well as autism and various different other neurological conditions, as well as multiple sclerosis, and only to mention a few. We will use an intravenous infusion, which again is IV, and that will be done with a natural sugar in order to allow the stem cells to penetrate the blood-brain barrier, because without that sugar, we have a very, very effective defense mechanism intertwined in our bodies, in our blood vessels, to prevent noxious chemicals and toxins to pass into the brain and the central nervous system. So in this case, this natural sugar allows for a short window for the stem cells to penetrate. It literally shrinks the parenchymal cells of the blood-brain barrier in order for these stem cells to get through. Again, it's a nice short window, so we're not risking the body in any way. And so that's number one. Number two, we will do an intranasal aspiration, which is like a nose spray of stem cells. And in our nasal cavity, we have turbinates, which are highly vascular, a lot of blood vessels. And so when we spray the stem cells, they penetrate very quickly into that network of blood vessels, and again, bypassing the blood-brain barrier, going directly to the brain. We also use an enzyme to help make the cribriform plate a little more penetrable to the stem cells as well, and that's another very effective way of allowing the stem cells to get through the blood-brain barrier. And then the third way with neurodegenerative conditions is, or in the case of autism, I should say neurodiversity, intrathecal. Intrathecal, which means more or less like a lumbar puncture of stem cells. And that is a direct injection right into the cerebrospinal fluid along the vertebral column. So that is, again, a very direct, very effective way of getting the stem cells past the blood-brain barrier and into the central nervous system. So in regards to the neurodegenerative diseases, these are the methods of deployment. When it comes to, say, an autoimmune condition, we will do very similar We will also do the IV so that the stem cells go everywhere the blood flows. We will do the intranasal aspiration because a lot of times with autoimmune conditions, we also we also encounter brain fog and a lot of central nervous system issues as well, memory, concentration, focus. And then what's really important with autoimmune condition as well is we will do an inguinal lymph node injections, which are direct injections of the stem cells into the lymph nodes to address the autoimmunity. So not only are we regenerating the damage that's been done, we're also trying to shut off the autoimmunity and halt the disease process. So it's very, very effective in autoimmunity. I know, Louise, I know you'll also ask me about local injections, and
I was going to ask you about the local injections.
I figured I may as well just continue my
intramuscular as well, and also intra-articular.
That's right. So we have various different types of local injections. It can include, skin and hair for skin and hair conditions and regeneration. It can include intra-articular, which is directly into a joint for cartilage issues, the degeneration of cartilage, as well as ligament and tendon injections directly into the ligaments and tendons. Into intramuscular, meaning right into the muscles. So if we have torn muscles, torn tissues, right into the muscle, as well as retrobulbar injection, which is a local injection behind the eye for eye conditions. So that's considered a local injection as well. Also, organ injections, local organ injections. So when we're dealing with kidney disease, liver disease, heart, cardiovascular disease, things like diabetes, where the pancreas is involved, erectile dysfunction, where there could be direct injury or circulatory problems in the penile area. So we will also consider local injections in those areas as well. And this will all depend on first safety first. So if we can safely do this without the risk of bleeding or clotting, and so on and so forth, we will also encompass or include these types of local injections in a disease condition.
So can these also be for cosmetic purposes, the local injections?
Absolutely. So I think I very briefly mentioned hair and skin injections. So absolutely, we will do stem cell injections into the skin for skin rejuvenation, collagen and elastin, diminishing fine lines and wrinkles, tightening, basic rejuvenation of the skin. And it could be anywhere. It doesn't have to be the face. It could be maybe burned areas. It can be different areas. And then, of course, scalp and hair rejuvenation for those patients that are looking to have a fuller, thicker head of hair. We will do directly into the scalp. And this is usually all done with local anesthesia.
Is there any cases that you do local and intravenous injections at the same time?
Oh, yes. Thank you for asking that, Louise. In most cases, we will include, for instance, let me give you an example. If we were doing a patient that needed local injections into a joint, in that case, IV wouldn't help that joint. An intravenous infusion wouldn't help the joint because the joint space is very limited in vascularization. So there's not much of a blood supply. So in that case, we have to do that local injection. So if the disease condition or the patient requires a systemic or IV infusion of the stem cells, we will do both. And in most cases, we will do everything that we can possibly do in order to get the best possible results. And that can include IV, a local injection. In the case of retrobulbar injection, for instance, we will do the IV with the retrobulbar injection with the intranasal aspiration because that we can get the stem cells to the eyes in that way as well. And so my motto is to leave no stones unturned. So if I can do, the more I can do in the more areas, the better for a patient and the disease condition.
And may I ask you, because I need to ask, in case of a local injection on a joint, does it hurt?
That's a really good question. So, in a lot of cases, we'll use a local anesthetic, something like procaine or lidocaine or something similar to that. We find that there's the little pinch of the needle, but in most cases we try to do without the anesthesia. It can hinder the healing to some degree, so I prefer no anesthesia. However, if the patient requires it, we'll probably use a very low dose of a procaine or something like that doesn't do much harm.
Is there any downtime, doctor, after the deployment of stem cells?
That's another very important question to address, because when we have joint conditions where we inject into the joint, there's not a downtime per se, because the patient we want the patient to be up and around and not sedentary. But there is a limited amount of time that they need to sort of rest in order and not go back to full activity and full exercise. We see a lot of athletic patients and athletes that we need a couple of weeks where they are not sedentary, they're walking around, they're doing some light exercise and light activity, but there is a requirement of a couple of weeks before they can get back to doing something a little more rigorous. But in terms of downtime and pain, very little, if any.
So, doctor, can you give me some examples about the organ injections?
Yeah, that's an interesting question, because patients do ask that, not as often as I would think, but that's an interesting question, because we will do local injections into or around an organ, again, depending on the degree of damage to the organ. Basically the limitations of the patient. Again, we want to consider any issues of hemorrhaging and bleeding and clotting and things like that. So more likely than not, we will do organ injections, considering all these aspects and limitations of a patient. And very successfully, we will inject in pancreas in the case of pancreatic disease or diabetes type 1. Again, my motto is to leave no stones unturned, but of course, safety first. And as a physician, we take the Hippocratic oath of do no harm, number one. And so we want to ensure that no harm will come to the patient in trying to accomplish the best possible treatment we can. And so we can do a direct injection into an organ in the correct area, visualizing the organ first under ultrasound, and being able to visualize everything very, very in real time. And so the pancreas, for instance, a kidney, we will inject into the cortex region of the kidneys to minimize bleeding and for safety reasons as well. Sometimes we'll just inject in the area of the organ. That could be the local blood supply or just the surrounding tissues around the organ itself. So we will deduce, again, on an individual basis, where we may inject for the best possible outcomes. And we weigh the risk to benefit ratio. So if it's more risky than not, we won't take that risk. If the benefits outweigh the risk, then absolutely we will do it, or we'll find a way to get as close to the organ as possible. And one thing to remember, we remind patients all the time, is that when we get the stem cells into the blood, they're getting to the organs as anyways, okay? Because the stem cells are going everywhere the blood flows into the bloodstream. And so we still get that great effect by doing the IV as well.
And may I ask you, is there a difference, or can you mention the type of stem cells that you deploy locally and that you deploy intravenously? Is there a difference, the type of stem cells that you use, or do you use specific stem cells for joints and for organs, different stem cells?
Luis, I don't think I've ever been asked that before, and that's a super question. Typically, okay, so The stem cells that we use at the Stem Cell Healing Institute are all considered adult mesenchymal stem cells. So whether they come from bone marrow or adipose tissue derived, sometimes we have to use one or the other, depending on the patient and the condition. Endometrial derived stem cells, umbilical cord derived stem cells. All of these are the same class of stem cells. So they're all adult mesenchymal stem cells, and they all function very similarly. There are some that may have slightly different properties. Maybe there are some that are more, maybe a little bit better suited to inflammatory conditions. Others that are better suited to autoimmune conditions, and so on and so forth. But for the most part, they're pretty much interchangeable. So yes, we will use almost any stem cell in the joint, almost any stem cell IV, almost any stem cell intranasally, intrathecally. So that's a really good question. The bottom line is they all fall under the same umbrella of adult mesenchymal stem cell, and that's what we use.
Well, that's very clear for me. Doctor, as always, I always ask you if there is anything else I need to ask you in this podcast.
I think maybe just to reiterate, which we've done in the past, the whole comprehensive treatment, which is really important. So with all of these stem cell deployment methods, whether we use 2 out of the 4 or 5 that we do, or 4 out of 4 or 5, we will always do the comprehensive pre and post treatment protocol, which includes the total detox program with the nutritional IV with very high antioxidant and B vitamins and minerals, and the suppositories as well as B vitamin shots. We will always use oxygen therapy. We will always use growth hormone therapy, but that is age appropriate. When children, we won't use the growth hormone for obvious reasons. And then, and we will always use the stem cell enhancement formula, formulated on an individual basis, so very personalized. And of course, we will not forget to include addressing our psychological, emotional, and spiritual aspect of healing as well, because I'm sure you've heard before that our wellness is not just our physical body. It goes way beyond that. So just to reiterate that no matter what we do and whatever deployment method we choose, we will always do all of the work up to that for the best possible results. Again, leaving no stones unturned.
Okay, doctor, that was a wonderful explanation. We really appreciate your time, and we wish you a great afternoon.
Thank you so much, Louise. You as well.
You take care, doctor.
Thank you.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.